I love this question. When you're doing a breast reconstruction for a breast cancer patient or a BRCA patient and you have chosen an implant-based reconstruction, there is really two ways to do it. Direct-to-implant is what I do. So at the time of the mastectomy, I put in the long-term implant at the same surgery. So you go into the operating room, you have the breast removed, and I reconstruct it with an implant. The other type of implant-based reconstruction is called a tissue expander-based or two-stage. Instead of going direct to your implant, you are starting with something different, which is called a tissue expander. This is a saline or saltwater implant that has a gummy port on it. This can be put in and left deflated or only partially inflated. And then they allow you to heal, or we allow you to heal for a couple weeks. You come into the operating room and we can slowly inflate the implant to the desired size. And then you go back to the operating room for a second procedure where you have the actual implant placed. So that is a two-stage procedure versus direct to implant, which is a one-stage procedure. My preference is always direct to implant. That's what I do in my practice. I think that should be the goal, if at all possible, but sometimes it's not. So as a patient, it's really important to discuss with your surgeon whether you are a candidate for one stage versus two stage. And if you're not a candidate, ask them why.